Hello, I'm Kate Pagan. I'm the Chief Nursing Information Officer. The videos you will see next contain my friend and colleague, the late Dr. Paul Southern. He was the key driving force in the EPR programme and was passionate about patient care and safety and the way that it supports it. We felt that continuing to use these clips would be a good way to continue his legacy. I'm sure that he would be very proud to continue to be a part of this important programme.
Hello, my name is Paul Southern and I'm the Associate Medical Director for Informatics. In this short video, we're going to look at how you can change the components within the clinician workflow to make it easier to use and navigate. So if we turn to the screen, we have a test patient up here. Going into the menu, we select Clinician Workflow. And as you know, Clinician Workflow is the Trust's recommended way of making sure you see all the appropriate aspects of a patient's care in one flow. So there's different versions. There's a clerking one, a post-take one, a progress one, which is very powerful as it allows you to see all of the patient's previous documents and open them up in the site in a window. It also lets you go through and look at current medication, allergies, observations, laboratory results and medication. So it really means that you're seeing everything in one place. I make use of the outpatient workflow a lot, but sometimes people say it's confusing because there's lots of things there. So how I've changed this is you're on the clinician workflow and you go to the tab that you're interested in this case outpatients. Go across the far right hand side and you'll see here 3 horizontal bars with a little down arrow. Click this, click components, and this allows you to add or remove components. So in this example here, I've taken out clinical summary, I've taken out history presenting complaint, and I've taken out review of systems. To me, this makes it work for me because I have here problems and diagnosis at the top, so I can add problems such as hypertension, type 2 diabetes, and fatty liver. When I'm clerking a patient in outpatients, I can then make the hypertension and diabetes chronic. And I'm going to make the NAFLD the reason for today's visit. I then can record medications, allergies. I can then type in some free text, both for specialist history and also use examinations for using auto text to record an examination. I can add in new orders and then I can type a very brief summary there. If this order wasn't to my liking, how you change this is you go to this left hand pane here, which has the directory of the components, and you can move it. So say I wanted to put examination above history, I just do that and it changes on there, and it will always maintain this edit. So I'm going to put problems and diagnosis down, and again it will then hold that. Clinician workflow is the best way to manage patients, both as for ward rounds and also for inpatients. It makes sure that you see all of the important information about a patient in one place. We recognise that it's quite generic, and that's why there's an ability to change the components of the system. Have a bit of a fiddle around, make sure that it suits how you practice, and this will allow you to make sure clinician workflow works well for you.